Hi, Dr. Neal Beightol, clinical dermatologist, coming to you from beautiful Marco Island, Florida. I wanted to take a minute today just to explain one of the reasons that I became an independent consultant for Rodan and Fields. Now, back when I was in college, I had a job in a dermatopathology lab. That's a place where skin cancer biopsies are processed and pathologists make diagnosis. That's a really cool place for a college student to have a job, and I loved it. I got to process the specimens, I got to sit with the pathologist, I got to go back and forth between the lab, the pathologist, and the dermatology offices. But I had a really bad case of acne at that point in my life. And because I was a college student, I really didn't have the funds for expensive acne treatments or even for office visits for that matter. So I just thought maybe one day I'd grow out of it. But I never really understood the impact that acne was having on my self-esteem, and I wouldn't until later on. But one day I was in a dermatologist's office, and he and I kind of passed in the hallway. I'd never met this guy before. And he paused as if he was going to say something, and then he just kept on going. So I didn't know what to make of that, so I just did what I needed to do, and I left the office. But as I was in the parking lot, I heard a voice behind me, and I turned around, and it was the dermatologist. He'd actually followed me out of the office into the parking lot and asked me if I had ever had my acne treated. When I said no, he dragged me back into the office, took me in the supply closet, and began loading me down with samples of acne medication. I took my samples home, I began to use them, and lo and behold, about a month later, my acne was gone, my skin was clear, and something amazing had happened. My confidence, my self-esteem just went through the roof. And I realized that very significant thing, that how I thought the world saw me really was impacting the way I saw the world and impacting my own self-esteem. Maybe it shouldn't be like that, but it is. So that's one of the reasons that had such a major impact on my life. I went on into medical school. I became board certified in family medicine because I wanted to go on the mission field, take medicine out into the far reaches of the world, be able to practice medicine anywhere, anyhow, anytime. But I always had a love for dermatology in my heart, and that was one of the major reasons, because I saw what a difference it made in my life. So years later, after going in the Air Force, studying dermatology there, coming out and practicing clinical dermatology here in Southwest Florida for the last 15 years. About 70% of what I do is skin cancer detection, surgery, reconstruction. I have a robust cosmetic practice as well, but I always have a special place in my heart for those acne patients because I remember what a difference it made in my life. And that's another reason that I'm so excited about Rodan and Fields. You see, Katie and Kathy Field, Katie Rodan and Kathy Fields, they saw the vision that if you could take dermatology care out of the dermatology office and make it available to the world, that lives would be changed around the world. And I really resonated with that vision because I remembered that man who went out of his way to do something that he didn't have to do, and it really changed my life. So if you're a consultant out there with Rodan and Fields, just feel really good about that you are in the business of changing skin and changing lives. If you are somebody who really needs some skin care, this is the right place, because I've been using Rodan and Fields products in my office for the last 2 years. My patients love it. I'm a dedicated provider of products, but also a user and consumer, and I find that it is the best skincare product that I have ever used personally and for my patients. So again, thanks for your time, but that's one of the reasons that I'm involved with Rodan and Fields, because they are really changing the world and making it a better place. Thanks. Bye.